Hello everyone, welcome back to Sowkya Med Vision. We are discussing bones of upper limb. In the previous lectures, we have completed clavicle, scapula, and humerus, their anatomical and site determination, their features, attachments, and their involvement in the joint formation. Today, we are going to discuss about the radius, the lateral bone of forearm, which is homologous to medial bone of leg, that is tibia. Let's see. The part extending from elbow to wrist is known as forearm, containing two bones, laterally radius, medially ulna. So the lateral bone radius is homologous to medial bone of leg is known as tibia. So the radius containing three parts. As we know, every long bone containing three parts: upper end, shaft, and the lower end. The radius involved above with the lower end of humerus in the formation of elbow joint. The radius in the below, the lower end of the radius, is involved in the formation of wrist joint with the proximal row of carpal bones. Yes, let's see the radius. Now, as I said, the bones of forearm are radius and ulna. Radius is presented laterally, whereas ulna is presented medially. The radius is homologous to bone of leg, that is medial bone of leg, that is tibia. Now, as I said, radius is a long bone which containing three parts: upper end, shaft, and the lower end. Now, the upper end, the main features of upper end are head, neck, and radial tuberosity. Let's see in the picture. See, this is the head of radius. This is the constricted part is neck of radius, and this extended projection like part is radial tuberosity. So the main three parts in the upper end of radius are head of radius, neck of radius, radial tuberosity. And now let's see the features of head. Head is a disc shaped. See, this is the head, right? This is disc shaped and articulates with the capitulum of humerus in the formation of humeroradial articulation. So this part is the head, which is disc shaped, is involved in the articulation with capitulum of the humerus. The capitulum is presented in the lower end of the humerus, is articulated with the discoid shape of head of radius and involved in the formation of elbow joint. And now neck is constricted. As I said, neck is constricted part and head is circumferenced. This head is circumferenced and radial notch of ulna. So this circumference head is articulated with radial notch of ulna. See, this is the radial notch of ulna. This head is articulated here, forming superior radial ulnar joint. There are two joints, superior and inferior radio-ulnar joint. So the head of radius circumferenced, which is articulated with the radial notch of ulna, forming radio-ulnar joint. And now, yes, this here it is encircled, which is surrounded by annular ligament. Remember this, it is encircled by annular ligament. And now let's see the shaft. Shaft, it is a laterally concave. Shaft presenting laterally concave. This is the radius, right? This will be the lateral one. So it is presented convex, not straight, but it is convex. And now it containing anterior border, posterior border, medial border. That is three borders and three surfaces. Let's see anterior border. It starts below anterolateral of radial tuberosity. As I said, this is a lateral tuberosity giving insertion of biceps brachii. Yes, it has two insertion. One of that is radial tuberosity, which give insertion of biceps brachii. So the anterior border is extending from below the radial tuberosity. At the above, it is represented by anterior border is represented by anterior oblique line. In the bottom, it is represented at styloid process. Yes, and now posterior border. It is well defined in the middle 1/3. Let's divide the posterior border into three parts: upper 1/3, middle 1/3, and below 1/3, lower 1/3. So the posterior border is prominent in middle 1/3 and it is represented as posterior oblique line. See, this is the posterior view. This will be the posterior middle 1/3 represented by posterior oblique line. And now medial border. So this is the medial border towards another bone. So these two borders are the interosseous border. Medial border of radius, lateral border of ulna are the interosseous borders, as these borders are giving attachment of interosseous membrane. Interosseous means bone. Inter means between two bones. The membrane presenting between two bones is interosseous membrane. Now let's see the surfaces. Three surfaces: anterior surface, posterior surface, and lateral surfaces of shaft. Anterior surface is extending between anterior and interosseous border. Yes, and posterior surface is presented between interosseous border and the posterior border. Posterior border is represented by posterior oblique line, and interosseous border, it is a medial border. Lateral surface, it is extended between anterior and posterior borders. Yes. And now let's see the lower end. The lower end of the radius containing 5 surfaces. You must remember these 5 surfaces. Yes. Now the lower end containing 5 surfaces: anterior surface, posterior surface, medial surface, lateral surface, and inferior surface. Anterior surface is thick and ridge. It is representing a thick ridge for the attachment of palmar radiocarpellar ligament. Palmar radiocarpellar ligament. Yes. And posterior surface containing a tubercle. It is containing a tubercle. This is a posterior view. So this is containing a tubercle known as dorsal tubercle, or it is known also Lister's tubercle. Now the tubercle is lateral to dorsal tubercle, presenting a groove for the passage of tendon of extensor carpi radialis longus, extensor carpi radialis muscle. Extensor carpal radialis longus means longest muscle, long muscle, brevis means short muscle. And now medial surface containing a ulnar notch. See, this is the medial surface. This will be the lower end of medial surface of the lower end, containing ulnar notch of radius. For what? Articulation with the head of ulna. Yes, this is the head of ulna, forming lower radio-ulnar joint. And now lateral surface. This will be the lateral surface. This is the lateral surface. It is represented by styloid process. Inferior surface articulates with scaphoid. Scaphoid is one of the carpal bones. The inferior surface is articulated with the scaphoid bone, forming in the wrist joint. Yes, the 5 main surfaces of lower end are anterior, posterior, medial, lateral, inferior. Except superior, all other surfaces are presented in the lower end. This is the discussion of radius. If you like the video, please do like. Don't forget to subscribe.